and greetings to Sir Aziz, our lecturer for HSM475. I am HAZARA BINTI Muhammad ASLAM from BA2352C. We are from Group 1. We will be presenting density and distribution of oncologists in Malaysia. Oncologists. So basically, what is oncologist and oncology? Oncologists are the specialists, and oncology is a study of cancer. When the cell reproduces itself uncontrollably and spread to all over the body part, this is known as cancer. Therefore, oncologists are the doctors that are specialized in detecting and also treating cancer. But what does oncologists use to detect cancer? So basically, oncologists use MRI scan, CT scan, biopsy, endoscopy, ultrasound, and other radiological techniques to detect cancer. Malaysia lacks internal oncologists. There are several states in Malaysia that is in need of oncologists, since the death of cancer diagnosed patient has been rapidly increasing. Therefore, oncologist is needed to detect the early diagnosis of cancer, and also oncologist is needed for the treatment of cancer.
Thank you, Zara. I will continue this presentation. Hi, I am SITI, AYUNI, MASTIKA, and for density distribution of oncology. As we can see from the table, the number of oncology in the nation from 57 in 2009 to 67 in 2010. With around 43% working in the public sector within a year, the number of oncology practicing in the public sector from 29 to 33, while the number practicing in the private sector from 28 to 34. Then the Deputy Minister of Health, Dr. Lim Boon, said that out of a total of 150 oncologists in the country in 2019, only 42 were employed by public institutions and private ones employ 73. Then according to KHAIRUZI, the nation will only have 128 oncology till February 2022. The data show that the number of oncology is growing but only slightly from year to year, which indicates that this is a further issue, and the number of oncology for the public sector decreased in 2022 compared to 2019. Next, for the table, we can see the oncology on every state in Malaysia, but majority of oncologists are in Wilayah Persekutuan Kuala Lumpur. These statistics show an increase of 1% can be seen in 2010 with a total of 10 specialists. Next, the increase of oncology in the period of 9 years is as much as 48%, which is still less because after almost 10 years, Malaysia still need to be at level of 50% in MOHD target. The latest data in 2022 show an increase of 30% from 2019, which is 128. This is increase in due to the training in every hospital for prospective oncology, such as in the Klang Valley with a majority of 148 students followed by Johor and Penang. However, Malaysia is still experiencing a shortage of oncology which should exceed 300 specialists according to the current Malaysian population, as well as an increase in cancer patients. But the workforce of oncology is not sufficient because there are just 2 oncology for every million people, far lower than the 8.8 oncology per million seen in the affluent nation. Next, I will pass this presentation to ATIRAH.
Hi, my name is NURHIDAYATUL ATIRAH binti KHAIRUZI and my student ID is 2022-76222. So here I will continue regarding the issue. So the first issue is the shortage of oncologists in Malaysia. So as previously stated, Malaysia has a shortage of oncologists in all existing states. As we know, only a few oncologists are available in our hospitals and only a few hospitals have provided those treatments. It is quite difficult, especially for patients who need the treatments, but there is the limitation to finding them. So from this, we can also see that the lack of oncologists in Malaysia is causing the issue of getting more treatment. So this is because patients with cancer in Malaysia are increasingly year on year, but the number of oncologists in Malaysia has also decreased, which causes difficulties for reasons. And then the second issue on how people with cancer receive care in Malaysia. So in Malaysia, there are slightly more than 150 practicing oncologists, although the ratio of about one oncologist for every 220,000 people is still considered inadequate. The number of oncologists has more than tripled in the last 20 years. Along with this positive trend, the number of specialty surgeons, molecular laboratories, oncology and radiotherapy centers, and non-governmental organizations (NGOs) championing cancer care advocacy has increased. Almost all cutting-edge cancer treatments and equipment such as radiation therapy, immunotherapy, and target therapy are available in Malaysia. Cancer patients in Malaysia can also participate in clinical trials. Despite rapid advances in cancer research and treatment, there is often a fear of seeking treatment. This fear exists for a variety of reasons, including concerns about the possibility of disability, treatment-related side effects, societal stigma, diminished body image, financial toll, and death. So here I will continue with the balance or unbalanced distributions. So currently we can see that the number of oncologists is not favorable to the current issues and ratios of patients in every state in Malaysia. So there are some cases that we can look at based on the historical records. So the reported cancer incidence rate from 2012 to 2016 was 86 cases per 100,000 males and 102 cases per 100,000 females, representing 11% increases over the 2007 until 2011 report. So this may be due to low cancer awareness and screening, delays in seeking medical attention, delays in detection and diagnosis, and insufficient access to high quality cancer care. So despite the rise in cancer incidence, Malaysia has slightly more than 150 oncologists, which is about half of the required 300 to meet the country's oncology service requirements. So every year, oncologists leave the public sector to work in private practice. So due to the low number of oncologists in public sector, it's becoming increasingly difficult to increase the number of new cancer studies at public hospitals, which are the primary sites where trials are conducted. So these difficulties are exacerbated by many people's perception that clinical research in public hospitals is often not given the same level of recognition and importance as it would be in teaching institutions and comes in second or third place of the clinical service. So that's all from me. Thank you.
Okay, now we come to the suggestion solution. Before explanation, I will introduce myself. My name is STANLEE and my ID matrix is 2022977 Okay, as you can see above, the figure of number of oncologists in Malaysia was unbalanced. So we can come up to the solution of optimal balance. In state of Malaysia, the figure was not evenly. There was certain state was in bigger numbers of oncology specialists, while the other state got a lowest number of oncologists. For example, in Sarawak, despite being the largest state in Malaysia, they got only 7 oncologist specialists there, and that's also in the Kuching only, not in the rural or minor city. They got 2.56 million residents, so 7 oncologists is rather quite unlogical to them handle this big population. So next, at the Peninsula state of Malaysia, the number of oncologists was big in major city rather than small city. Malaysia has to put this number and send them to the rural or small city that insufficient in number of oncologists there, so that this small city or minor city got a better treatment in cancer care. Okay, finally, also to increase the number of oncologists so that they can have an optimal balance in the Malaysia, there is about the graduate in oncologists. So as we can see in the data above, there are only 70 oncologists graduate in Malaysia, and that's only yearly 17. So did not quite catch up to the rate of cancer nowadays people get too high. Even now in the global way, a lot of incurable disease and diseases that are too dangerous, such as COVID and virus and cold, they are too dangerous for us. So Malaysia should have an attempt an alternative such as funding a scholarship for students, or maybe a exchange program, and also a collaboration program with another nation to resolve this issue. Okay, now we come to the distribution of worker. Workforce in oncologists, as mentioned above, likely or not, is not enough. The rate of oncology specialists increased, but only a small number. Not only that, the rate of people getting cancer also increased, so they didn't quite catch up there. So this make Malaysia hard, make a harder situation for Malaysia. Because of time to produce best specialists in oncology was long. To be more productive, oncologists should work with other healthcare specialists such as radiologists, surgeons, nurses, and even paracetamol company, so that they can get a better result in care of treatment of cancer care. And lastly, it's about the technology. As we can know, technology can resolve the issue of shortage of workforce, because the data people nowadays can get in single touch of the technology, such as a system of telemedicine, telepathology, and also teleconference. So this technology saved a lot of time, and also they didn't people at the outside of city or the village with minor city, they didn't get as much of better in cancer treatment care, so they can use this technology, utilize them to approach the healthcare. And also oncologists, this make the number of oncologists, maybe the need will be not in many demand anymore. So that's all for me. Thank you.
Now, proceeding on to the how can we solve the issue of unbalanced distribution of oncologists in the state of Malaysia, or how to solve the issue of lacking of oncologists in Malaysia. Well, first of all, the government need to provide an alternative treatment. Even the healthcare industry should provide alternative treatment. The alternative treatment is by establishing cancer care model in Asia. What is cancer care model? Cancer care models provides treatment, cancer therapy, medical care, social support, dietary requirements, and also nutrition to help the cancer diagnosed patient. The doctors and health providers can together collaborate as a team to provide an individualized personal treatment by integrating cancer care strategy. The government can help or contribute by promoting early cancer detection and also prevention of cancer via public awareness and also education campaigns. Now, proceeding on to the second way to solve this issue. This could be done by creating new opportunities to widening the job scope and education of oncologists. This could also be done by providing a specialist cancer center in Malaysia. How actually the government or the health industry can widen the job scope of oncologists? Well, they can help the people who want to pursue oncology by developing by establishing career routes that could help them to get into the oncology sector. And now proceeding on how the government or health industry can widen up education for education of oncology for the oncology students. But they could done this by providing regular workshop for oncology to know more about cancer and the treatment of cancer, and then they could also provide them the opportunity to meet professional and experienced oncologists, so that they could learn from their experience and also learn deeper about oncology. Well, this could also be done by bringing in more new technology to Malaysia for oncology. As we know, we have ultrasound, MRI and CT scan, and Malaysia is lacking of biopsy and endoscopy to help with detecting cancer. To conclude all of this, Malaysia should collaborate with Beacon Hospital to provide oncology service to Sabah, Pahang and Terengganu, because Sabah, Pahang and Terengganu are the three states which is in need of oncologists and they lack of oncologists right now. So if Malaysian government are able to provide these three states with oncology center, so this will actually help the cancer patient there to receive the treatment and early detection of cancer. This will help a lot since this can save many people's lives there and also spread the awareness about cancer. Thank you. That's all from us.